That was a study that we did that we interviewed physicians that refer people for screening, and we interviewed participants in our screening program with a view towards understanding whether or not an understanding of the extent of the benefit would influence them. And the reason this becomes a question is because there's different interpretations as to how much of a benefit screening has, with some people, including some societies, taking the view that the overall magnitude of the benefit is 20%, meaning that you're only going to cure 20% of the people with lung cancer in the program. And there's an alternative view which says that that only applies to people who were enrolled in a research program, but when people are enrolled in an actual clinical program, you're actually curing the cancers 80% of the time, or 4 out of 5 times. So it's a huge difference. On the one hand, you're saying we're going to cure you 20%. The other hand, we're saying we're going to cure you 80%. So we tried to understand, we wanted to put those, in particular, that issue directly to clinicians and to participants to see how much of an impact it might have in terms of their thinking about whether or not that might influence their decision to join a screening program. So that was the basic question we had asked. The interview showed some very interesting findings. We found that in general, both patients and physicians viewed lung cancer screening as either as important or more important than other forms of screening, including mammography, colon screening, prostate screening. So screening itself, everybody viewed as important. In terms of that question as to the magnitude of the benefit, how it might impact, we found a difference between the clinicians and the participants. The participants were basically felt that if there was a benefit, they almost didn't perceive much difference from them in terms of wanting to participate. So long as there was a benefit, they felt, great, I'll participate. So it didn't seem to impact their decision very much. Some it did, but the majority, there was a small percentage that it impacted, but the majority felt, so long as there's a benefit, we're okay. The clinicians, on the other hand, were much more bothered by it. They said that this really is very confusing to them, and it impacts the way they think about screening, and they find that the whole topic is very confusing. And that, to me, means that we have to get the message out in a much more coherent way, because lung cancer screening is not being taken up at the level we had all hoped it would be taken up, with some 10% of eligible people only being screened. So that's a really pretty dismal result. And I think that what we're getting from this study is that the impact is mainly on the referring clinicians, that they're confused about the extent of the benefit. And when the extent of the benefit can be viewed as being pretty low, the choice of doing it becomes, plus minus. They're on the fence about whether they should be talking to people about it. So I think that this really says we should take it to the societies and make sure that there's a coherent message that they can give to their referring clinicians about the extent of the benefit, because right now they're stuck with this view that it's relatively small, and we think the magnitude is actually quite high, and we need to get this message out. I think that would have a big impact on screening uptake. That was the basic gist of that abstract or that poster presentation.